Which condition causes temporary blood flow loss to a specific area of the brain? Stroke, syncope, transient ischemic attack, or aneurysm? Transient ischemic attack. It is a brief episode of neurological dysfunction caused by temporary focal brain ischemia that resolves completely within 24 hours without permanent damage. Which condition causes inflamed air sacs and lungs? Pneumonia, asthma, bronchitis, or emphysema? Pneumonia. It is an infection usually caused by bacteria, viruses, or fungi. What is the term for inflammation of the liver caused by viruses? Hepatomegaly, viral hepatitis, cirrhosis, or jaundice? Viral hepatitis. Hepatitis A and E spread through contaminated food or water. Hepatitis B spreads through infected body fluids. Hepatitis C is transmitted through contaminated blood. Hepatitis D only occurs if already infected with hepatitis B. Which nerve controls taste on the anterior part of the tongue? Hypoglossal, glossopharyngeal, facial, or vagus? Facial. Through its chordotympany branch, it transmits taste sensations to the brain, where they are processed and perceived. Which condition involves immune system attacking joints? Bursitis, gout, rheumatoid arthritis, or osteoarthritis? Rheumatoid arthritis. The immune system mistakenly attacks the synovium, causing inflammation, pain, swelling, and possible cartilage and bone damage. Which nerve transmits vision signals? Abducens, trochlear, oculomotor, or optic? Optic. It is a bundle of nerve fibers that carries visual information from the retina to the visual processing centers in the brain, where it is interpreted as images. Which tissue forms protective outer layer of skin? Hypodermis, epidermis, dermis, or subcutis? Epidermis. It is made of stratified squamous epithelium, designed to protect against external elements and water loss. Which condition causes fluid buildup inside the air sacs of the lungs? Pleural effusion, pneumothorax, pulmonary edema, or hydrothorax? Pulmonary edema. It can result from heart or non-cardiac causes, leading to breathing difficulty. Which organ is the main site of cholesterol synthesis and conversion to bile acids? Small intestine, spleen, liver, or kidney? Liver. It synthesizes cholesterol to support cell membrane integrity and produce steroid hormones. Within hepatocytes, cholesterol is converted into bile acids through a complex enzymatic pathway, stored in the gallbladder, and secreted when needed. Which condition involves inflammation of liver? Cirrhosis, pancreatitis, hepatitis, or cholecystitis? Hepatitis. It can be caused by viruses, chemicals, drugs, alcohol, genetic disorders, or autoimmune reactions. Which condition is characterized by fluid around the heart? Myocarditis, myocardial infarction, pericardial effusion, or endocarditis? Pericardial effusion. It is the buildup of fluid in the pericardial sac, which may compress the heart and interfere with its pumping ability. Which hormone regulates sodium levels? Cortisol, aldosterone, thyroxine, or insulin? Aldosterone. It is produced by the adrenal glands and increases sodium and water reabsorption while promoting potassium excretion. Which organ produces estrogen? Adrenal, ovary, uterus, or pituitary? Ovary. It is also produced in smaller amounts by the adrenal glands and adipose tissue. Which nerve controls shoulder movement? Radial, accessory, axillary, or ulnar? Accessory. It innervates the sternocleidomastoid and trapezius muscles, allowing head rotation and shoulder elevation. Which hormone stimulates thyroid activity? Growth hormone, thyrotropin, cortisol, or prolactin? Thyrotropin. It stimulates the thyroid gland to release T3 and T4 hormones, regulating metabolism. Which autoimmune disease primarily affects the joints and sometimes other organs? Fibromyalgia, osteoporosis, multiple sclerosis, or rheumatoid arthritis? Rheumatoid arthritis. It causes chronic inflammation that damages connective tissue, producing pain, swelling, and reduced mobility. Which nerve controls swallowing reflex? Phrenic, facial, hypoglossal, or vagus? Vagus. It coordinates throat and esophagus muscles for safe swallowing. Which organ regulates blood sugar? Kidney, liver, thyroid, or pancreas? Pancreas. It produces insulin, which lowers blood sugar by helping cells absorb glucose and storing excess in the liver, and glucagon, which raises blood sugar by releasing stored glucose. Which hormone triggers uterine contraction? Oxytocin, prolactin, estrogen, or progesterone? Oxytocin. Released by the pituitary gland, oxytocin initiates labor contractions and helps the uterus contract after delivery, returning it to its pre-pregnancy size and reducing bleeding. Which organ detoxifies ammonia? Kidney, pancreas, spleen, or liver? Liver. It detoxifies nitrogen by converting ammonia into urea, which is then eliminated by the kidneys. Which condition causes excessive thirst? Diabetes, Addison's disease, hyperthyroidism, or Cushing's syndrome? Diabetes. It occurs when high blood sugar in diabetes mellitus or low ADH activity in diabetes insipidus disrupts fluid balance, leading to intense thirst. What is the medical term for sudden chest pain due to reduced blood flow to the heart? Angina pectoris, pericarditis, myocardial infarction, or arrhythmia? Angina pectoris. It is not a disease, but a symptom that the heart muscle isn't receiving enough oxygen-rich blood. The pain often feels like pressure, squeezing, or heaviness in the chest, and usually signals coronary artery disease. Which organ produces digestive enzymes and hormones for glucose regulation? Pancreas, liver, stomach, or gallbladder? Pancreas. It secretes enzymes and hormones such as insulin and glucagon to manage digestion and blood sugar. What is the medical term for involuntary shaking of the hands? Tremor, Parkinson's disease, ataxia, or dystonia? Tremor. It involves rhythmic, involuntary muscle contractions that affect movement. Which organ is primarily responsible for filtering damaged red blood cells from the bloodstream? Bone marrow, spleen, liver, or thymus? Spleen. It identifies and removes old, damaged, or abnormal red blood cells, recycling their components. What is the term for inflammation of the bronchi in the lungs? Bronchitis, bronchiectasis, pneumonia, or asthma? Bronchitis. It is an inflammation of the bronchial tubes, causing them to swell and produce mucus. What is the medical term for reduced blood clotting due to low platelets? Leukemia, hemophilia, thrombocytopenia, or anemia? Thrombocytopenia. It occurs when the blood has fewer platelets than normal, making it harder to form blood clots and increasing the risk of bleeding and easy bruising. What is the medical term for abnormal curvature of the spine? Kyphosis, lordosis, osteoporosis, or scoliosis? Scoliosis. It involves sideways bending of the vertebral column, often affecting posture. What is the medical term for inflammation of the appendix? Peritonitis, acute appendicitis, diverticulitis, or cholecystitis? Acute appendicitis. It causes swelling and pain in the lower right side of the abdomen and often requires an emergency surgery to prevent rupture. What is the medical term for inflammation of the bladder lining? Urethritis, pyelonephritis, glomerulonephritis, or cystitis? Cystitis. It is usually caused by bacterial infection, producing painful urination, urgency, and frequent bathroom visits. Which cell organelle converts glucose into energy through cellular respiration? Mitochondria, Golgi apparatus, endoplasmic reticulum, or nucleus? Mitochondria. It produces ATP by breaking down glucose in the presence of oxygen. What is the term for inflammation of the lining around the lungs? Bronchitis, pleural effusion, pleurisy, or pneumonitis? Pleurisy. It produces sharp chest pain that worsens during breathing as lung membranes become irritated. Which nerve transmits signals from the face to the brain? Facial, trigeminal, optic, or vagus? Trigeminal. It provides most sensory input from the face to the central nervous system. What is the medical term for excessive, male pattern hair growth in women. Hypertrichosis, hirsutism, virilization, or alopecia. Hirsutism. Hirsutism is caused by excess androgens, leading to coarse, dark hair growth in women on the face, chest, or back. Which organ stores and releases bile into the small intestine? Gallbladder, spleen, pancreas, or liver? Gallbladder. It concentrates bile and releases it into the intestine to help digest fats. What is the term for inflammation of the joints in the knee? Tendinitis, bursitis, meniscus tear, or arthritis? Arthritis. Arthritis is a general term for inflammation of the joints, and while there are many types of arthritis, they all share symptoms like pain, swelling, and stiffness in the joint. Which gland produces hormones that regulate water and sodium levels? Thyroid, parathyroid, pituitary, or adrenal gland? Adrenal gland. It secretes aldosterone and cortisol, which regulate fluid and electrolyte balance. What is the medical term for abnormal fluid accumulation in the abdomen? Ascites, edema, hydrocephalus, or pleural effusion? Ascites. It is often caused by liver disease or heart failure, producing abdominal swelling and discomfort. Which organ is responsible for filtering and regulating blood pressure? Heart, liver, kidney, or lung? Kidney. The kidneys filter waste and excess water from the blood to make urine. They also help regulate blood pressure by adjusting blood vessel diameter and by using hormones to control how much water the body retains or excretes. What is the term for inflammation of the lining of the heart? Cardiomyopathy, myocarditis, endocarditis, or pericarditis? Endocarditis. It results from infection or autoimmune reaction, damaging heart valves and inner lining. Which nerve carries sensory signals from the arm and hand to the spinal cord? Median nerve, ulnar nerve, radial nerve, or brachial plexus? Radial nerve. It carries sensory information from the arm and hand to the spinal cord through a network of nerves originating from the brachial plexus. What is the medical term for abnormal increase in white blood cells? Leukocytosis, lymphoma, leukemia, or neutropenia? Leukocytosis. It may indicate a range of underlying health issues from benign to serious conditions like leukemia. Which organ absorbs nutrients from digested food? Large intestine, esophagus, stomach, or small intestine? Small intestine. It contains villi and microvilli that increase surface area for nutrient absorption. What is the term for inflammation of the joints due to uric acid crystals? Gout, rheumatoid arthritis, osteoarthritis, or bursitis? Gout. It results from uric acid crystal buildup in joints, producing sudden severe pain, swelling, redness, and restricted movement. Which gland regulates metabolic rate through hormone secretion? Pituitary, thyroid gland, pancreas, or adrenal? Thyroid gland. It produces hormones such as thyroxine and triiodothyronine that control metabolism, growth, and energy use. What is the medical term for chronic inflammation of the skin? Eczema, dermatitis, psoriasis, or rosacea? Dermatitis. It produces persistent redness, itching, and skin lesions caused by immune or allergic reactions and environmental factors. Which organ secretes enzymes to digest fats, proteins, and carbohydrates? Pancreas, liver, small intestine, or stomach? Pancreas. It releases enzymes including lipase, protease, and amylase to break down nutrients for absorption. What is the term for sudden shortness of breath due to airway obstruction? Laryngospasm, bronchospasm, pulmonary embolism, or pneumonia? Bronchospasm. It is a sudden contraction of the airway muscles, reducing airflow and causing difficulty breathing, often seen in asthma or allergic reactions. Which nerve controls movement of the eyes? Optic nerve, trochlear nerve, oculomotor nerve, or abducens nerve? Oculomotor nerve. It regulates most eye muscle movements and pupil constriction for proper vision and alignment. What is the medical term for reduced secretion of digestive juices? Achalasia, dyspepsia, hypochlorhydria, or achilia. Achilia. It reduces the secretion of gastric juices, impairing digestion and nutrient absorption,